Yes, ma'am, we are.
Yes, ma'am. Yes, ma'am.
Yes, ma'am, we can. Can I share my screen? Hello, am I audible? Is now? Is that fine? Hello, can I audible? Now you can hear me, right? Okay, can I share my screen? Is my screen visible? Yeah. Good morning, everyone. Myself, Moksha. No, uh, I'm from Tirupati, Mohan Babu University, and our paper is about intelligent fabric quality assessment using machine learning and color morphological techniques. Basically, the aim of this paper is uh, in any fabric industries, there will be many uh, fabrics which are being built. For that, there may be any issues of like there may be holes. Yeah, yeah, sure. Give me a second. Is this okay? Okay, I did actually. Can I screen share myself again? Is this fine? Yeah. Okay. uh, our paper is mainly about identifying the defects in any image. Basically, it is in a fabric. Here we'll be using both traditional and deep learning model. It is an hybrid model because in traditional approach there will be many things like it is easy to do and the cost of the manufacturing will be less. Whereas in deep learning there will be many things where we can make use of deep learning so that the things will become very fast for doing. That is our basic aim to do. And then out this will be the identifying if you see here traditional inspection method fails to provide high accuracy, false defects and real-time monitoring. It's like if there are many images we cannot find defects in every image, so we'll use deep learning model to find the defect and do the things. Here we'll be using three stages. That is, first will be removing the shadow, and then second will uh, identify the defect, and then we'll extract the feature. For eliminating the shadow, we'll be using CNN model, and then for defect, we'll be using morphological operations, thresholding, and Gaussian noise. Whereas for feature extraction, we'll be using SIFT, which is scale invariant feature transform, and then canny edge detection. That is the three stages we'll be using to find if there is defect in any image. This will be our architecture. Here, if we take, we'll give input as a raw any image where CNN first will remove shadows. If there is any shadow, maybe the technique may even the shadow it can consider it as a defect and it will give it as an defect. So before to escape that thing, we'll remove the shadow first and then we'll convert into gray, that is RGB to gray, so that it can easily do Gaussian noise. If there is any noise in the image, we'll remove it. And then thresholding, we'll like if we take a value, if the value is the pixel value is greater than the threshold, then it will become white. Why white? That means one. If there is a threshold less than one, less than the threshold, it will become black, so that we can easily identify the image where is the defect. And then morphological operations will be done so that there will be no other things which will affect us defecting. And then after that, we'll go for stage three, which is feature extraction. Here we'll be taking the images and we will make an like boundary so that where the defect is there, we can easily identify it. That is the system architecture we have. Uh, Dataset. Here, if we take, we used a data set from Kaggle, which is around 2,739 images. Here we did 70, 20, 30, 10 type. That is 70% it's training, 20% testing, and then 10% validation, so that the accuracy will be more thing and we can easily identify if there is anything. Then these are the results we found. Here, this is the original image. Firstly, we removed the shadow using CNN, and then for detection, we used Gaussian noise thresholding and morphological operations. And feature extraction, we used SIFT and canny edge detection. Even this is one of our output. Yeah. For accuracy, if there is any, what is the state of thing, we use the SSIM, which calculates the accuracy and how accurate our results are. And for our paper, we got 94.2% of accuracy. That is the thing. Yeah, I think I'm done with my presentation. Am I audible? Yeah, yeah. This is the thing. I think I'm done with my presentation. Sorry, I think. Yeah. Sorry, I'm so sorry. Your voice is very low. Yeah, yeah, yes. Hmm. Actually, we have image processing, right? Where we'll be using morphological operations and everything. And we even have deep learning things. If we combine both, there will be more accuracy and it will be fast for doing. Yeah. Hmm. Yes, it is possible, right? Yeah. Thank you so much.
Yes, ma'am. Good afternoon, ma'am. May I present my screen? Just ma'am, is my screen visible? Very good morning to one and all present here. I am Varisha Pathak from the Department of Biochemistry at Jawaharlal Nehru Medical College, Wardha. Today, I will be presenting our paper titled Artificial Intelligence Driven Insights into the Impact of Fasting on Cancer Risk and Treatment Outcomes. Cancer continues to be one of the leading causes of mortality worldwide. Although conventional therapies like radiotherapy, chemotherapy, they are available and are effective also. They are often associated with toxicity or resistance, and they also, as we all know, they reduce the quality of life. Recent evidence suggests that fasting may influence cancer metabolism and improve treatment response. At the same time, artificial intelligence offers powerful tools to analyze metabolic and clinical data in a personalized manner. This paper explores how AI guided fasting strategies may contribute to precision oncology. The rationale behind this topic comes from the limitations of current cancer therapies. Many patients experience severe adverse effects, immune suppression, and variable therapeutic responses. This creates a need for supportive strategies that are more personalized and metabolically targeted. Emerging studies suggest that fasting may reduce inflammation, enhance chemotherapy sensitivity, and selectively protect healthy cells from stress. Therefore, integrating fasting and AI-based predictive systems could potentially optimize cancer care. The objectives were for our paper were primarily two. There were two objectives. The primary objective being first to evaluate the role of fasting in cancer prevention and treatment outcomes, and second to examine how AI can analyze fasting related biological and clinical data. Um, and secondary objectives included understanding mechanisms linking fasting and cancer metabolism, exploring personalized fasting strategies, and identifying ethical and clinical challenges associated with the implementation. Now, let us go to the types of fasting. We reviewed three major fasting approaches commonly. The first is intermittent fasting, involving alternating fasting and feeding periods. The second is time restricted feeding, where food intake is limited to a specific daily window. The third is the fasting mimicking diet, a low calorie dietary approach designed to reduce fasting psychology while maintaining some nutrient intake. These approaches may produce several biological effects. There were like enhanced autophagy, that is, when cells eat their own, when the body's cells eat their own cells, reduced glucose and insulin signaling, reduced inflammation, and increased metabolic stress, specifically on cancer cells. So the role of artificial intelligence plays an important role in precision oncology. AI systems can process large-scale databases, including metabolic markers, genomic profiles, patient history, and treatment responses. Machine learning models can help identify which patients may benefit from fasting-based interventions. AI also enables predictive analytics, personalized nutritional recommendations for the patients, and dynamic monitoring of patient response. This shifts fasting from generalized approach towards a precision medicine strategy. The AI that I am referring to over here, that is in our paper, we primarily refer to machine learning based predictive models and data driven clinical decision systems. These systems can analyze multidimensional databases such as the metabolic markers, genomic data, treatment response, and nutritional parameters to identify patterns and personalize fasting interventions. This study was conducted as a narrative literature review and conceptual analysis. We reviewed oncology literature, fasting related metabolic studies, clinical research articles, and AI based healthcare applications. The analysis focused on cancer metabolism and metabolism, mechanisms of fasting, AI driven predictive models, and treatment outcomes. The results. Our review suggests that fasting may contribute to improved metabolic regulation. Challenges remain. Clinical fasting, such as clinical challenges remain. Clinical fasting, such as clinical fasting, uh, may increase the risk of malnutrition, of fatigue, and there is variability in patient depending on the cancer type and nutritional status. There is also a lack of standardized fasting protocols and limited long-term clinical validation. From the AI perspective, challenges include dependence on high quality datasets, algorithmic bias, and limited accessibility to low resource settings. Ethically, patient privacy, informed consent, and transparent AI assisted decision making remain essential contradictions. In the future, AI driven predictive models may enable highly personalized fasting protocols based on metabolic, genomic, and clinical profiles. Integration of metabolics, biomarker analysis, wearable biosensors, and real time monitoring could optimize fasting during chemotherapy and radiotherapy, and combination of fasting with immunotherapy and targeted therapy represents an exciting emerging decision for in precision oncology. To conclude, fasting includes metabolic and cellular changes that may contribute to cancer prevention and improve therapeutic response. Mechanisms such as reduced insulin and IGF-1 signaling, enhancing autophagy and reduced inflammation. This may selectively stress tumor cells while protecting normal cells. And artificial intelligence enables advanced analysis of personalized fasting based interventions. Although current evidence is promising, larger clinical trials and standardized protocols are still required before routine clinical implementation. And overall, AI assisted precision fasting uh, represents a promising emerging strategy in personalized oncology and supportive cancer therapy. Here are the references, and that is the end of my presentation. Thank you. Ma'am, I'm so sorry. Your voice is very low. Oh, I'm very sorry, ma'am. This presentation did not show that. The study was conducted on a direct sample size, uh, and hello. Ma'am, so for over here, uh, the paper did not involve primary patient recruitment since this was a review, uh, and I did not state this there. I'm very sorry because it is a literature review and conceptual analysis. Thank you so much, ma'am.
Yes, ma'am. Am I audible? Ye- Yes, ma'am. Ma'am, is my screen visible? Hello, everyone. My name is Rishabh Kothari from Jawaharlal Nehru Medical College, Datta Magi Institute of Higher Education and Research, Wardha. Today, I'll be presenting a review on AI-based chronic lifestyle diseases, risk assessments, and applications, focusing specifically on cardiometabolic risks like metabolic syndrome. I will briefly outline the unique cardiometabolic problem facing the Indian demographic, state our research objectives, talk about how machine learning and deep learning models are outperforming traditional diagnostic markers, and mention the key findings and challenges. Asian Indians face a massive 33.5% prevalence of metabolic syndrome. This is largely driven by the South Asian phenotype, a genetic predisposition to developing type 2 diabetes and cardiovascular disease even without severe obesity. Traditional radiological methods are simply too slow and imprecise to catch these risks early enough. Our objective was to comprehensively review how effectively artificial intelligence, specifically machine learning and deep learning, can predict these cardiometabolic risks. We specifically focused on comparing AI's ability to analyze novel markers against conventional clinical diagnostic tools. This includes evaluating inflammatory indices, epicardial adipose tissue, and image-derived phenotypes. To understand this intersection, we conducted a targeted PubMed review. Because indigenous Indian studies applying AI to metabolic syndrome are currently limited, we expanded our scope to include high-quality, robust international studies to establish a baseline of what these technologies can achieve. Based on our textual analysis of the study conducted by Libby and the team, conventional liver attenuation yields an AUC of 0.70, while an unenhanced abdominal CT scan-based deep learning model utilizing image-derived phenotype achieved an AUC of 0.82. However, the optimal prediction was achieved by, by a combination of IDP and VAT, that is visceral adipose tissue, which reached an AUC of 0.84. Interestingly, the same study by Libby and the team, the performance was of these deep learning models was observed to not be uniform across demographics. Sex-based stratification analysis revealed that while image-derived phenotype was a stronger predictor in males, visceral adipose tissue was a stronger predictor in females. Although combination of visceral adipose tissue and image-derived phenotype yielded the best results. This highlights that AI models are highly sensitive to biological differences and require careful demographic tuning. Looking at specific models, Bao and Wang applied machine learning to over 3,079 shift workers. By analyzing predictors such as lymphocyte counts and inflammatory indices, they evaluated 4 different models as shown in the chart. They looked at light GPM, XGBoost, linear regression, and random forest. A very important nuance here regarding the training versus testing data needs to be addressed. In the light GPM model, it achieved a massive training AUC of 0.94. While that looks impressive at first glance, later the testing AUC dropped significantly to 0.72. In stark contrast, when looking at the XGB model, it had a training AUC of 0.81. But when it maintained its performance to achieve the highest testing AUC of all 4 at 0.747. This narrow gap shows that this model has good generalization and making XGBoost the top model for predicting metabolic syndrome in this particular scenario. While random forest proved to be the most reliable across datasets with the least difference between training and testing dataset. Beyond fat metrics, AI excels at identifying hidden prognostic markers. Lin and colleagues analyzed data from over 2,000 participants who were tracked for 14 years as a part of AIS NER registry. They proved that the addition of fully automated AI measures of epicardial adipose tissue volume substantially improved the reclassification of major adverse cardiovascular events. We also looked at predicting comorbidities. Singh's team used a hybrid model combining SVM or support vector machines and XGBoost to predict hypertension in patients who already had diabetes. This unique multi-stage pipeline outperformed 10 other benchmarks, achieving an AOC of 0.81 and proving the power of hybrid ML models. Despite these successes, integrating AI into the Indian healthcare landscape presents a major hurdle. We face significant infrastructure limitations, poor data quality, and severe confidentiality concerns. Furthermore, relying heavily on CT scans introduces a real clinical risk of radiation exposure, requiring us to. Okay. In conclusion, AI and deep learning modalities are incredibly robust tools for early cardiometabolic risk assessment. While routine implementation could drastically reduce morbidity, the critical next step is validating these international models on large scale multi-ethnic Indian cohorts. Thank you for your time. Thank you. Thank you.
Hello, am I audible? Bhuvan ma'am, name for yes. Is my screen visible now? Hello, hello ma'am, am I audible? Yes, yes ma'am. Uh, Good afternoon everyone. Today I Bhuvan Rekhi. I will be presenting our paper entitled AI-driven approaches in sleep apnea from mechanistic insights to precision diagnosis and therapy. Sleep apnea. Sleep apnea is one of the common yet underdiagnosed sleep related breathing disorders affecting millions of people worldwide. It is characterized by repeated interruptions in breathing during sleep, leading to intermittent hypoxia, sleep fragmentation, excessive daytime sleepiness, and increased risk of cardiovascular, metabolic, and neurocognitive complications. It is of three types: obstructive sleep apnea (OSA), central sleep apnea (CSA), and complex sleep apnea. Obstructive sleep apnea is caused due to upper airway collapse, which is most common. Central sleep apnea is caused due to impaired respiratory drive. It is as less common as compared to obstructive sleep apnea. Complex sleep apnea is a combination of both OSA and CSA. Risk factors include obesity, large neck circumference, alcohol, sedative use, and large tonsils, uh, craniofacial abnormalities, and smoking. Pathophysiology of OSA, obstructive sleep apnea. It involves upper airway obstruction during sleep, which leads to intermittent hypoxia, sleep fragmentation. There is activation of sympathetic nervous system, which leads to inflammation and oxidative stress. Clinical features include uh, loud snoring, witnessed apnea, gasping or choking during sleep in nighttime. Daytime symptoms include excessive daytime sleepiness, morning headache, poor concentration, and fatigue. Complications include hypertension, arrhythmia, stroke, heart failure, insulin resistance, metabolic syndrome, cognitive impairment, depression. Diagnosis: the gold standard method is polysomnography. It includes overnight sleep study. It measures the apnea hypopnea index to determine the severity of the sleep apnea, obstructive sleep apnea. Pathophysiology of obstructive sleep apnea. Uh, Recurrent upper airway collapse during sleep causes intermittent hypoxia, hypercapnia, and sleep fragmentation. It includes various factors like upper airway anatomy and structural factors, which include narrow or collapsible pharyngeal airway, fat deposition in tongue, soft palate, and lateral pharyngeal walls. Uh, Enlarged soft tissue is also another cause, which includes microglossia, enlarged tonsils, uvula cause airway blockage, common in obesity, Down syndrome, and acromegaly. Neuromuscular dysfunction is another cause, which includes reduced tone of genoglossus and tensor palatini muscle during sleep. It leads to upper airway collapse. Uh, impaired reflex ac- uh, Impaired reflex activation is also another major cause. Pathophysiology of central sleep apnea. It includes failure of brainstem respiratory centers to generate the proper breathing signals. Uh, it is uh, it in, uh, it is of two types. A, which includes impaired ventilatory control and breathing instability, dysfunction of respiratory control mechanism, peripheral chemoreceptors detect oxygen levels, central chemoreceptors regulate CO2 in brainstem. Failure of neural respiratory signaling causes apnea episodes. Mechanism in underlying CSA, central sleep apnea. Increased chemoreceptor sensitivity causes unstable breathing, abnormal response to hypoxia, and CO2 changes. Kine-Stokes respiration commonly seen in heart failure. Diagnosis of sleep apnea. There are three diagnostic criteria. First, it includes symptoms which includes excessive daytime sleepiness, fatigue, non-restorative sleep, insomnia, breathing problems during sleep, loud snoring, pauses in breathing, gasping, choking noises, waking up, struggling to breathe, diagnostic confirmation, which include polysomnography, sleep study for obstructive sleep apnea. If diagnostic criteria greater than or equal to 5, predominantly obstructive events or per hour with symptoms greater than or equal to 15 events per hour regardless of symptoms is high regarding obstructive sleep apnea. Challenges and ethical considerations. Recent research insights. It includes various insights. First, neurocognitive impacts. Untreated obstructive sleep apnea is associated with neurocognitive problems affecting memory impairment, reduced executive function. Mood disorders association. Modern evidences links obstructive sleep apnea with mood disorders such as depression, anxiety, irritability. Highlights the importance of evaluating sleep quality in mental health care. Cardiovascular. Yes, ma'am. Uh, cardio Therapeutic intervention. It includes various types of positive air pressure techniques such as CPAP, continuous positive air pressure, BPAP bilevel positive air pressure. CPAP provides constant air pressure throughout the breathing. Uh, BiPAP provides different pressure during inhalation and exhalation. Conclusion: Central sleep apnea is a serious disorder with multiple health complications. CPAP therapy remains the permanent treatment of obstructive sleep apnea. New therapies include hypoglossal nerve stimulation, pharmacotherapy, AI diagnostic techniques, and various other diagnostic methods. These are the references. Thank you.
Am I audible? Is my screen visible? Yes. Oh, one second. Am I visible? Is my screen visible? Full screen? Oh, good afternoon, everyone. I'm Dr. Ambika Prasad Das. I'm a second year postgraduate resident in the Department of Community Medicine from Jawaharlal Nehru Medical College, DMI HER, Wardha. So this is my topic, leveraging Internet of Things and wearables for enhanced community-based geriatric care. These are the outline of the presentation. So global aging population is increasing rapidly. The proportion of elderly individuals is growing worldwide, creating new healthcare challenges. As we can say that in the year 2050, the Indian population of elderly individual is likely to cross more than 1 billion. So this includes the rising burden on community geriatric-based healthcare, and it also includes significant challenges that the healthcare systems might face with the increasing demand of long-term elderly care within the communities. What we essentially expect is that the high risk of falls and chronic diseases in the elderly, the older adults are more susceptible to falls, frailty, and multiple chronic health conditions. So coming to there is limitations of traditional monitoring methods. What we used to have earlier is that we had nurses, we had doctors who used to give periodic healthcare checkups to the elderly people. But now this has been a limitation because of difference in incubation period, as well as the the advanced cardiovascular diseases that has been monitored recently. So there is a need for real-time technology-driven solutions, that is the wearables or Internet of Things, which provide continuous monitoring through smart devices, and they can help in early detection and timely intervention of many diseases. So what are the objectives of having the Internet of Things and wearables? To explore the devices, these wearable devices in geriatric care, to analyze their applications in monitoring and disease management, to evaluate the challenges and adoption barriers. It's not that elderly people are well equipped in using such wearable devices or Internet of Things, and to highlight future directions or the new era of science in community-based elderly care. So what methodology we used was, this was a narrative literature review approach, a conceptual based literature review approach from various journals on various indexing sites. Okay. And what we had the analysis of primarily three parts: the wearable IoT applications, the sensor based monitoring systems, and the empirical and bibliometric studies. that helped us in assessing how these the wearable devices and how do they function and how do they help in early detection and prevention of diseases in the elderly. The objective was to assess their usability, clinical effectiveness, and potential for integration into modern geriatric healthcare services. It's not that only the wearable devices that are only being used by the adolescent or the people of the mid 40s or 50s. It is also this can also be used to the geriatric population. Okay. So what we, after narrative review and after reviewing many of the literatures, we found the results that continuous real-time health monitoring using wearable devices. Wearable sensors can provide uninterrupted tracking of vital health parameters like respiratory rate, pulse, even the blood pressure, and also the temperature of the people. High accuracy in cardiac monitoring, that is the ECG sensing systems like the heart rate or heartbeat monitoring systems were accurate to around 99.7%. What is that? IoT-enabled ECG systems can detect cardiac abnormalities with excellent accuracy. In case of chronic disease management, like tremor or any like a chronic blood pressure, essential hypertension, the essential factor reduced by 77 to 85%. That is, we can say that wearable technology significantly improved the symptom control in chronic neurological conditions. What happened in the mental health assessment? The mental health assessment showed 71% accuracy in the Internet of Things and wearables. The sensor data that can help in identify and monitor mental health conditions like seizures or Alzheimer's or tremors with reasonable accuracy. Next, we found that the supports in fall detection and activity tracking. The elderly people have the high risk of fall, frailty, and accidents. And smart sensors that were used in devices can detect falls and continuously monitor daily physical activities. Thus, it improves early detection and preventive care. Continuous monitoring facilitates timely intervention before serious complications can occur. They can also alert the nearby healthcare system. So, what essentially we found in the that we can discuss as a discussion part is enhances the IoT or the wearables enhances elderly independence and self-care. They do not need to depend on anyone for their monitoring or observation of their healthcare parameters. This also enables early intervention and remote healthcare access. It's not necessary that they have to move to the doctor anytime to know their healthcare status. The continuous monitoring and continuous feedback of the data that the wearables they are using, this can be used to alert the local or the nearest healthcare facility. They can help that to have the telemedicine communications. They also help in better adherence with community and professional support. What they do is the integration of AI, age, and blockchain. This helps in improve decision making and data security. However, certain limitations are also there, like usability issues, cost, and low long-term adoption. Usually, the learning of using of such healthcare wearable devices or Internet of Things, this is also a part of limitation that we are facing nowadays. So we can see that this is the structure of our healthcare system. What is the physiological signals and long-term care centers? They encode the parameter from the body and they send it to they encode the parameter of the body and they keep it as a data. And then AI-driven acquisition system and advanced electronic fences, they combine their the data lag and they provide a particular central system care. Okay. Oh, sorry. This is the generalized equation of having all the Internet of Things. Now we can see the challenges and ethical considerations. We have user-related challenges, we have technical, we have system level and ethical challenges. Coming to the future prospects, development of user-friendly, low-cost wearable devices are very useful for elderly people. Integration of artificial intelligence for real-time decisions. We can also improve the interoperability and standardization of such devices, and we can also help in strengthening caregiver and social support systems. So conclusion is, technologies like AI, edge computing enhance efficiency of the wearable devices and towards human-centered accessible elderly care systems. So these are the references that I have. Thank you. Thank you.
Yes, ma'am. So sorry, I think I have shared the wrong screen. I'm so sorry, ma'am. I'm not able to share my screen. I don't know why. Okay, ma'am. Is it there now? Okay. Okay. So good afternoon, ma'am. Good afternoon, everyone. I'm Dr. Kimaya, and I'm from JNMC Varda. So I'll be presenting the findings out of my paper, which is titled as. Can I close this? How do I close this? So sorry again. Is it visible, ma'am, now? Hello? Okay, ma'am. So I'll be presenting the paper, which is titled as Mobile Health Technology in Disease Prevention and Clinical Practices. So this is the outline of my presentation. So for the introduction, as we all know that mobile phones and applications and wireless devices, whichever we are using for the purpose of preventing disease, improving health or support patient are called as mobile health. So this also enables reminders, monitoring and virtual consultations. It is widely used in India, in government and in private sectors as well. So during COVID-19, the use of this was increased and it is still growing because of more number of people using the smartphones. So it is mostly useful in areas with limited healthcare access. So in short, these are few types of mobile health application, which is first is health and fitness apps, second is nutrition and diet apps, third is mental health applications, fourth is telehealth and consultations, fifth is health monitoring, sixth is medication management, and seventh is health information. All of us must have used this at some point in our life. So the objectives of my paper was to evaluate the role of M-health application in clinical care and preventive health, to assess their impact on the disease management and lifestyle modification, and also to identify the challenges and gaps in the Indian healthcare system. The methodology that I have chosen is, as this is a narrative review, my focus was on clinical and preventive healthcare. So I also included global and Indian studies. Total 21 papers were included into this. So the results in my paper is mHealth application showed a high adoption and usability, improving patient engagement, positive impact on physical activity, maternal health, and health education as well. It showed improved chronic disease outcome. Chronic diseases such as diabetes and hypertension are very, very prevalent in today's era. So it shows a better control in better glycemic control in diabetic patients. It also helps in medication adherence and lifestyle modification. But the challenges that I came across were digital literacy, internet access, the cost, and cultural barriers. So these are few numbers. As we in the as we can see, number of mHealth applications available currently in global are around 3,50,000 and in India are around 54,000. So comparing to the mobile phone users globally and in India, around 60% of global population are adult population. 60% of adult population globally are using mHealth apps, and 69% of adult population in India are using medical health applications. So the most common uses that were found were fitness, chronic disease, mental health, and maternal health for global. And for Indian region, it is also fitness, women's health, and mental health. So these are the graphs made out of the previous. This shows the percentage presentation. So for the discussion, many other papers have similar outcomes, but the limitations were small samples and short duration and lack of strong clinical outcomes. And findings are consistent globally, but Indian context faces few challenges. So the future prospects: integration of AI-based predictive analytics for personalized care, development of vernacular languages interfaces, inclusion of offline functionality, better integration with national programs like digital health initiatives, and it needs large scale long term studies. Also focuses on affordable and culturally appropriate and scalable solutions. The conclusion would be medical health application is a promising tool for healthcare delivery and prevention of complication like in NCD cases. It also improves patient engagement, adherence, and lifestyle behaviors. It shows benefits in chronic disease management and maternal health as well. It is useful in resource limited areas and hard to reach settings. The evidence is encouraging but limited by small samples and short follow up. It requires robust research and better integration into health system. The challenges, there are few challenges like digital divide, which takes in consideration urban and rural population, the difference between them. Another challenge is also cost and accessibility. These have affected. So, ma'am, these are my references, and thank you very much. I'm done. Sure. Thank you, ma'am.
Yes, ma'am. Yes, ma'am. Ma'am, may I begin? Yes, ma'am. Good afternoon, judges. My name is Netri Upadhyay. Ma'am. Yes, ma'am. Ma'am, actually, I'm the second author for this paper. I'll be presenting on behalf of the first author. He was unable to be present today. Yes, ma'am. Sorry, ma'am. Good afternoon, judges. My name is Netri Upadhyay and I am from JNMC Wardha. I will be presenting this paper today titled Hypersexuality in Mental Health, Understanding, Diagnosing and Treating the Uncharted Territory on behalf of the first author. Hypersexuality can be referred to as uncontrollable sexual urges and behaviors that can impair personal, academic, and professional life. It may exist as a primary condition or a symptom of mental disorders and can affect both psychological as well as neurological health. The object Yes, ma'am. Yes, ma'am. The objectives of the study were to understand hypersexuality and its causes, to explore the various diagnostic challenges that we encounter, to examine psychiatric associations, and to also review the available treatment approaches. For the methodology, a systematic review was done following the PRISMA guidelines. The main databases searched were PubMed and PsycInfo. Studies from 2002 to 2023 were included, and they focused mostly on diagnosis, treatment, and management. There are various etiological factors that can be responsible for this particular disorder. Brain injuries and frontal lobe damage seems to be the primary one. Hormonal influences and testosterone and psychological factors such as mood disorders, along with medication side effects, can also be the factors involved. There are various neurological links. For example, frontal and temporal lobe damage can be linked with hypersexuality disorders. It is mostly seen in dementia and stroke patients. It may also be associated with Kluver-Bucy syndrome and can occur after a temporal lobotomy. This particular disorder may also be linked with depression and anxiety, may act as a coping mechanism, may also be associated with intimacy issues, and can overlap with addictive behaviors. Specifically, when we talk about BPD or borderline personality disorder, impulsivity and emotional instability are very common. Higher prevalence of compulsive sexual behaviors can be seen. It may include risk free or paraphilic urges, and relationships can often seem unstable. It may also often appear during mania or hypomania. There may be an increased sexual drive during mood episodes. There may be impulsive sexual behavior, and mood stabilization proves to be crucial into it. When we talk about its intersection with dementia, we see that there is usually sexually inappropriate behavior that can be seen in memory disorders such as dementia as well as Alzheimer's. Memory loss and disinhibition are the major contributing factors towards this, and social cue misinterpretation is very common. One very important thing to remember here is that medication effects may worsen these symptoms when we talk about this. Now, when we talk about these particular disorders with hypersexuality. There are higher depression rates that are seen in patients of hypersexuality, and this can create a vicious cycle that can impact the overall well-being and relationships of the people who are affected. It can impair academic and work performance. It can lead to guilt and social stigma, and when severe, can also create emotional distress. One of the major treatment approaches for this particular disorder is psychotherapy. Multimodal therapy is also recommended in many cases. Self help groups and counseling can prove to be beneficial, and medication may also be used in severe cases. Anti-androgens are one of the primary pharmacological management strategies for this particular disorder. Cyproterone acetate can be sometimes described. Treatment can be individualized to patient history, and there is always a need for evidence-based guidelines. The challenges in future directions, there are as of today, there are limited randomized control studies. There is a lack of universally accepted diagnosis. There is always a need for individualized treatment plans to treat patients better, and there is more research required in the area of mental health care. The conclusion: hypersexuality is a complex multidimensional condition that requires both psychological as well as a biological understanding. The early diagnosis can improve the outcomes, and integrated treatment approaches prove to be essential. These were the references that were used. Thank you so much. Thank you. Yes, ma'am. Yes, ma'am. Thank you.
I'm audible, ma'am. Yes, 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 ma'am. Yes, ma'am. Um, ma'am, presently kitchen to open kudu mate. Open, open.
ओपन नहीं होता है
Hmm.
ये विनू तेरा है क्या ये ओपन नहीं हो रहा है इसका
कहाँ से? यहाँ से होता ना शेयर स्क्रीन।
व्हाट्सएप व्हाट्सएप ओपन करना
नहीं, व्हाट्सएप में नहीं है वो PDF।
ये क्या
Contact. यहाँ पे PPT present। Hello.
Hello? Hello? Yes, sir. Hello? Hello, myself, ma'am, Rushika Shingole, Department of Biochemistry, JNMC. Today, I am presenting on topic. Today, presenting our research paper title, that is the AI-assisted early detection of and prevention strategies for pediatric hemorrhoidal disease. The hemorrhoids are change me. Yeah. Change. Some technical issues. मैम यस मैम तो टेक्निकल इशू आ रहा है मैम थोड़ा नेक्स्ट स्लाइड नहीं हो रही ओके मैम
Yes, ma'am, I'm here. Yes, ma'am. Yes, ma'am.
हेलो
Ma'am, is my screen visible? Yes, ma'am. Ma'am, my camera is unavailable. Um, Good afternoon. Myself, Dr. Divya Panikar. I am from the Department of Community Medicine, JNMC Dattamegi Institute of Higher Education and Research, Wardha. The title of my paper is Satellite-Based Public Health, Leveraging Remote Sensing for Real-Time Disease Surveillance and Environmental Risk Mapping. This is the outline of my presentation. The main objectives of my review are to understand how satellites like MODIS, Sentinel, and Landsat are used in disease surveillance, to evaluate environmental indicators such as aerosol depth, aerosol optical depth, and NDVI and land surface temperatures, to assess the integration with GIS and machine learning for early warning systems, and finally to identify barriers and future directions for implementation in public health infrastructure. The conventional public health surveillance often depends on hospital data, field surveys, and laboratory confirmations. The major issue here is that the delay by the time data is collected and analyzed, outbreaks may already be spreading. At the same time, climate change and rapid urbanization are changing environmental conditions like air quality, temperature, water contamination, and mosquito breeding habitats. So the satellite remote sensing offers a solution because... Ma'am, is it visible now? The satellite remote sensing offers a solution because satellites continuously monitor these environmental changes in near real time. For example, here, the aerosol optical depth can estimate the particulate matter up to 2.5 micrometers in pollutions. And NDVI, that is the normalized difference vegetation index, which measures the vegetation density. And thermal imaging helps identify urban heat islands and high-risk zones. The paper here was designed as a narrative review. We have reviewed published literature focusing on remote sensing technologies, disease surveillance applications, environmental risk mapping, and real-time public health monitoring systems. The goal was to evaluate how satellite-derived environmental parameters can support predictive healthcare decision-making. Original articles, review articles, and applied insights were used to curate this narrative review. Now coming to the key findings of the review arm, we found out that satellite systems such as NASA's MODIS, European Space Agency's Sentinel and Landsat are capable of monitoring major environmental health indicators continuously at resolutions ranging from 10 meters to 1 kilometer. These satellites can track land surface temperature, vegetation cover, air pollutants like nitrous oxide and sulfuric dioxide, and aerosol optical depth. This allows large-scale monitoring of air pollution and prediction of respiratory disease burden without depending entirely on the ground monitoring stations. Another major application is urban heat island detection. Thermal imaging showed cities can be 2 to 10 degrees hotter than their surrounding regions, which strongly correlates with heat-related illness and mortality. We also found out that NDVI and moisture mapping can identify mosquito breeding habitats, making it useful in predicting dengue and malaria outbreaks. An important advancement in the integration of satellite data with artificial intelligence is artificial intelligence and machine learning. Models like random forests, support vector machines, and deep learning algorithms can identify disease hotspots with high predictive accuracy. This allows public health authorities to target interventions before outbreak peaks. We also reviewed platforms such as NASA's EODIS, HealthMap, and Gleam, which combine satellite and epidemiological data into real-time dashboards. The major shift here is from passive disease reporting to predictive disease management. That is, instead of waiting for the hospitals to report the rising cases, health systems can proactively identify the high-risk regions and allocate resources earlier. Despite the potential, several practical challenges remain. Yes, ma'am. The challenges here, major technical barriers that we face are satellite data sets often do not integrate easily with healthcare databases, and effective implementation requires GIS and geospatial expertise. There is also limitations like funding in technical infrastructure and trained workforce. The ethical considerations are equally important in such cases. There are concerns such as privacy, stigma, discrimination, and data sovereignty in respect to the community. So it should be taken care of. The future prospects here include AI and deep learning models, which are increasingly effective at identifying environmental changes weeks before outbreak peaks. Then combining satellite feeds, clinical data, and crowdsourced reporting creates more robust surveillance system capable of detecting localized events that satellites alone may miss. and future collaboration can be done with different agencies such as space agencies, health ministries, epidemiologists, and data scientists to create a more cohesive approach. To conclude, satellite systems like Landsat, MODIS, and Sentinel are transforming public health surveillance by enabling continuous environmental monitoring. These technologies allow governments to act proactively in predicting outcomes, optimizing resource allocation, and improving disaster preparedness. These are my references. Thank you so much for your time. Thank you so much, ma'am.
Yes, ma'am. Yes. Is my screen visible? Good afternoon, everyone. I am Bhuvan Rekhi, and today I am presenting our paper titled Restless Leg Syndrome Clinical Features, Pathophysiology, Associated Conditions, and Management. Uh, Restless Leg Syndrome, Bhuvan, Bhuvan Rekhi. Yes, ma'am. Yes. Restless leg syndrome is a common movement disorder. It is a common neurological sensory motor disorder characterized by irresistible urge to move legs, often accompanied by unpleasant sensation. These symptoms typically worsen during periods of rest and at night, leading to significant sleep disturbances and reduced quality of life. Important risk factors include iron deficiency, renal failure, rheumatoid arthritis, diabetes mellitus, Parkinson disease, celiac disease. Uh, Review. Restlessness legs syndrome. Main symptoms include uncomfortable sensation in legs, urge to move legs, worse at night and at rest, relief with movement. Onset and progression can occur at any age, often before 20 years, may improve or worsen with the time. There are two types of restlessness leg syndrome: primary, idiopathic, or secondary. Primary is cause is unknown. Secondary is caused by sudden onset after 40 years of age. Uh, Primary is gradual in onset before 40 to 45 years of age. It may remit. Secondary daily symptoms and it is linked to medical conditions or drugs. Diagnosis, clinical diagnosis, labs like tests, various tests are given like ferritin test. Sleep studies in selected cases. Associated effects include sleep disturbances, anxiety, depression, reduced quality of life. uh, it can be relieved by exercise like walking, yoga, stretching, and leg movements. There are various factors which influence the restlessness leg syndrome. First of all, first factor is dopamine. Dopamine role in restlessness leg syndrome. Dopamine dysfunction plays a major role in the development of RLS. Uh, Abnormal brain iron metabolism also affects the dopamine activity. Iron deficiency is commonly associated with the restlessness leg syndrome and may indicate anemia. Oxygen levels in the legs may correlate with the increased symptoms, which increase severity. Associated medical conditions like end end-stage kidney disease and hemodialysis, diabetes mellitus, peripheral neuropathy, Parkinson disease, multiple sclerosis, sleep apnea, folate and magnesium deficiency. There are various lifestyle and hormonal factors like pregnancy may worsen the RLS due to increased estrogen levels. Caffeine, alcohol, and nicotine may aggravate symptoms. Another factor is interplay between RLS and ADHD. RLS and ADHD are both are associated with dopaminergic neurotransmitter dysfunction. Dopamine alternating medical condition may affect both disorders. Drugs that may trigger or worsen RLS are antidepressant, antipsychotics drugs, first generation antihistamines, antiemetics with dopaminergic action. Other contributing factors surgery may worsen the primary or secondary restlessness leg syndrome. Back surgery or injury may also trigger RLS. Recent research insight. There are four recent research insights which include neurocognitive impact. Sorry, ma'am, this is of previous slide. Uh, Management. Now comes to management of RLS, restlessness leg syndrome. Lifestyle adjustment. If there is no underlying cause of RLS, lifestyle changes may help to lessen its frequency. Quit smoking, exercise frequently, adopt better sleep hygiene. Medications include that may prescribe for the people with RLS, like GABA, pentinoids, dopamine agonists. Severe or unresponsive cases, opioids have been applied in many cases that are severe or unresponsive treatment considerations. It is the best to wait to pursue RLS treatment until all other potential medical explanations have been determined. Address underlying causes. If the underlying medical issues like anemia are adequately treated, secondary RLS may be cured. Yes, ma'am. Another management walking counter stimulation and medical intervention in RLS, like walking counter stimulation, iron supplementation, which includes intravenous iron supplementation. It reduces restlessness leg syndrome to a considerable extent. Medical intervention, which include dopamine agonist, which are supported by research to treat the RLS symptoms and improve the quality of life and sleep. Uh, these are the references. Thank you.
Yes, yes, madam, I am available. Is the screen visible, madam? Not visible. Okay. Okay. Now it is visible, madam? Yes. So, myself, Dr. Ashish Anjankar, presenting the topic Integrative AI Model Linking Serum Ion Dysregulation with Histopathological and Molecular Characteristics of Breast Cancer. So, topic is to link AI model with serum ion dysregulation and histopathological and molecular characteristics of breast cancer. We have kept presentation will be under the headings introduction, methodology, result, conclusion, and references. As we all know, breast cancer is the most common cancer in females, and the tumor behavior varies among the patients. Treatment response also differ amongst the individual. Mainstay of diagnosis currently rely on pathologies, that is histopathology, and then it goes to MRI and CT scan. Nowadays molecular biochemistry has evolved, so ER PR, that is estrogen receptor, progesterone receptor, and HER2 receptors are checked for molecular immunophenotypes. But all these conventional methods have limitations, and what we think AI can improve cancer prediction. So when we discuss role of iron in and AI, iron metabolism affects tumor growth. Iron imbalance also increases oxidative stress, which is a very common cause of any cancer. Genomic instability can also develop in iron metabolism, and metastasis risk can also become higher with iron dysregulation. So AI combines this different medical data, and it helps in risk stratification, and it will help us to support precision oncology treatment. Keeping in mind all these things, methodology for the study was to take the patient data and serum iron, which is not routinely done in breast cancer patient. We want to establish serum iron as a biochemical marker for breast cancer patient. So serum iron analysis was done. The patients which were considered were all confirmed by histopathology, which is the gold standard for diagnosis of breast cancer, and the patient's molecular immunophenotyping status was also done. What we are projecting again is AI and integration for this serum iron and histopathology, which will help us in developing risk prediction model for breast cancer patient. What we can get is iron dysregulation is linked to aggressiveness, as we can see in the figure. This AI framework integrating serum iron, histopathology, and molecular marker for prognostic uh, prediction of breast cancer. Because iron dysregulation is related to higher oxidative stress, increased inflammatory markers. So AI with iron, with molecular immunophenotype, with histopathology can definitely predict prognostic accuracy, which can enhance high risk cases detection for breast cancer. When we plan this study, we are already know there are some challenges and ethical consideration. Challenges will be iron variability because of some other diseases related to breast cancer. There will be data set heterogeneity, there will be limited annotations, and there will be generalizability issues because of the confounding factors in the study. Ethical issues will be patient privacy, AI bias, and clinical validation will be required when we discuss these things. So precision medicine in oncology, because iron influence tumor progression, and single biomarker as such is insufficient to detect or prognose breast cancer. So AI will enable this multidimensional analysis, and it will combine data set, will improve the prognostic grading of the patients of breast cancer. Precision oncology will become feasible and will help us in all these things. Future prospects will be in the field of data expansion, that is multicentric data set and standardized protocol. Advanced AI precision oncology is our main target when we discuss. To conclude, serum iron shows prognostic potential in breast cancer. AI will improve this biomarker integration with histopathology, molecular immunophenotypes, and by that risk stratification become more accurate. Personalized prediction will become more feasible because of this integration. Validation will remain very essential part of all these things, and precision oncology may improve outcome. So take home message from this study is AI integrated biomarker may transform breast cancer prognosis. So these are the references which were used for the study. Yes, ma'am. Yes, ma'am.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Yes, ma'am. I am for 371. I can present after this. Yes, ma'am.
Yes, ma'am. Huan in Chakra.
Script.
PPT issue or area. Ma'am, can you see PPT? Hello? Hello? Okay, ma'am. Good afternoon, ma'am. Myself, Purushika Shingule, Department of Biochemistry, Jawaharlal Nehru Medical College. Today, I am presenting on a research paper titled AI-Assisted Early Detection and Preventive Strategies and Pediatric Hemorrhageal Disease. Introduction. Hemorrhoids are a swollen vascular cushion in an anal canal. Ma'am, I am audible? Hello? Hello? Okay, okay, ma'am. Then usually common in adult, but now increasingly seen in children and adolescent. Modern lifestyle factors are contributing to rising pediatric cases. Low fiber diet, poor hydration, prolonged sitting, excess screen time, and functional constipation. Then children often hesitate to report symptoms. Invasive examination are less prepared in pediatric patients. AI can analyze behavior and clinical data for the earlier diagnosis. Then change नहीं हो रहा है. Then pathophysiology of the pediatric hemorrhoids. Then the anal canal contains the vascular cushion that helps maintain the continence. Then hemorrhoids develops when these cushions become the enlarged and displaced. The main mechanism in the children: chronic constipation, repeated straining during the deflection, increased anorectal venous pressure, venous congestion, and prolapse. Over time, this leads to pain, bleeding, swelling, and inflammation. AI biochemical models may help pediatric abnormal pressure pattern early. Then a classification of hemorrhoids: internal hemorrhoids are located above the dentate line and usually painless, bright and bright red bleeding during the deflection. Then external hemorrhoids located below the dentate line, painful and swollen, can develop the thrombosis. Then mixed hemorrhoids, the combination of internal and external hemorrhoids, the presents with the both bleeding and pain. In common pediatric symptoms, that is the rectal bleeding, itching, pain during the stool passage, and preanal discomfort. Risk factor in children's: the chronic constipation, repeated straining increases venous pressure. The poor diet, low fiber intake causes the hard stool formation, and processed food worsen bowel motility. Then sedentary lifestyle, that is the lack of exercise, slow intestinal movement, excess screen time linked with the constipation. Other factors, that is the obesity, dehydration, improper toilet habits, then family history. AI can combine this variable for the risk assessment. Why artificial intelligence? Then pediatric hemorrhoids are often underdiagnosed. Then symptoms overlap with fishes, infection, and dermatitis and constipation. AI can analyze the large volume of the health lifestyle data, detects the early warning pattern before the served patients appear, and supports non-invasive diagnosis in children. AI-assisted early detection approaches: the machine learning model that is used the stool pattern, diet, hydration, activity data, then predicts the risks of future hemorrhoids. Then smart toilet systems, that is the track the stool frequency and consistency, detect visible blood and abnormal bowel habits. Then computer vision that analyze the anorectal images, then distinguishes hemorrhoids from the fissures or infections. Then natural language processing, the extract symptoms from the caregiver notes and teleconsultation data. AI detection workflow, child health history collected, then lifestyle data entered, diet, water intake, stool frequency, screen time, physical activity, and AI model calculate the risk score. The alerts for the constipation or anorectal symptoms generated. Then pediatrician confirms the diagnosis and start the prevention plan. Preventive strategies aided by the AI. AI-based mobile apps provided. Yes, ma'am. Yes, ma'am. Yes, ma'am. Daily fiber reminder, water intake tracking, exercise goal, toilet routine reminders. Then variable devices monitor physical activity levels. Then predictive symptoms warn before the symptoms worsen. Then parents receive the personalized guidance. Then helps reduce the constipation related complications. Mathematical risk model. Then pediatric hemorrhoidal risk can be estimated by the combining multiple variables. Then treatment summary, the conservative management, that the first line, the high fiber diet, increase the water intake, sitz bath, stool softener if required, and regular exercise. Then medical management, the topical medications when needed. Then surgical management is reserved for the saver for refractory cases. Then AR role is a helps in a clinician choose the best treatment pathway. Then future scope and IEEE relevance, and then strong relevance to the IEEE themes, that the smart healthcare system, biomedical informatics, then machine learning in medicine, then preventive digital health, then future opportunities, the smart toilet for the home screening, variable pediatric health monitoring, and telemedicine with AI triage, then integration of a microbiome and plus biochemicals data, then better predictive pediatric care symptoms. Conclusion: the pediatric hemorrhoidal disease is an emerging lifestyle-related health issue, often caused by the constipation, poor diet, and dehydration and inactivity. Late diagnosis increases the discomfort and need for the invasive procedure. AI enables early prediction, monitoring, and preventive intervention. The smart toilet and variables and mobile apps and machine learning can improve the outcome. And AI assisted pediatric anorectal care may be reduce diseases burden in the future. These are the references, ma'am. Thank you. Yes, ma'am.
Hello, ma'am. Am I audible? Just a second. We'll put up the presentation. Is the screen visible? Thank you, ma'am. Good afternoon, judges and everybody in this conference. My name is Ayush Sinha, and I'm a third MBBS student at Jawaharlal Nehru Medical College, a constituent unit of Ratna Mega Institute of Higher Education and Research, located at Varda. Today, I am going to present my research paper. It is titled AI-based analysis of foreign accent syndrome, integrating neurological pathways, social linguistic and gender differences, and therapeutic advances in this field. So my presentation today includes the introduction, methodology, results and discussion, conclusion, and references to the topic. So what is actually a foreign accent syndrome? It is a rare speech disorder which is characterized by sudden change in the accent of the affected patient. It is associated with neurological damage, and it is also seen in cases of psychiatric causes of trauma, which is of sudden in nature, such as if patient experiences PTSD or some similar kind of things. And it is seen in mixed cases, such as in road traffic accidents, when a person has brain damage as well as physical, psychological trauma. So it is mostly related to that. It involves segmental errors such as phenome distortion and suprasegmental changes in speech, in pitch and rhythm. It is commonly linked to the brain areas such as motor cortex, premotor cortex, basal ganglia, and Broca's area. It is generally higher reported in females compared to males, and it was first described by Pierre Mary in 1907. In this research. Objective of this research was to study the foreign accent syndrome on the basis of neurological pathways, social linguistic influences, gender differences, diagnostic characteristics to diagnose foreign accent syndrome, and emerging therapeutic approaches in the field. And to highlight the multidisciplinary management which is needed to diagnose and treat this disorder. Methodology, it is a primary literature review, and my sources were from PubMed, Google Scholar, PsycInfo, and Scopus. The time range for the articles referenced in this study is from 1907 to 2023, and keywords were primarily foreign accent syndrome, neurological insight, gender disparities, and therapeutic frontiers. In my study, I included case reports, reviews, and meta-analysis. It was screened first by the title which they were published, the abstract, and the full text. And the data extracted from those sources were causes, features, gender differences, and treatment for the disorder. The results which I got from my research was that the stroke is the most common cause. 62% of the causes which lead to foreign accent syndrome is stroke. And the lesion is mainly in the left supratenutial region of the brain. It involves the motor cortex, premotor cortex, and the basal ganglia. And foreign accent syndrome can be divided into primarily 4 types: neurogenic, psychogenic, development, and mixed. So mixed is more about the mixing of the neurogenic and psychogenic causes, such as the example I have previously given in a road traffic accident. In the diagram next to it, we can see that basically the development basically goes into 2 different sites: neurological and psychiatric. Neurological is from the focal brain injury the patient has suffered, and the psychiatric is from dissociative disorder, where the language shift is there and the person mirrors some other personality of the patient. And for the clinical insights, in cases of brain injury, seizure activity is present in the patient, and for dissociative disorders to develop, severe stress and change in environment of the person is primarily responsible. Common features which is seen as a clinical feature in foreign accent syndrome is verbal distortion, which is common in consonants, and syllable timed speech is there. There is often associated conditions such as aphasia, where the person has difficulty in speech, apraxia of speech, and dysarthria, and the higher prevalence of females is seen in this disorder. Ethical challenges, the diagnostic difficulty is there. It requires listener perception, depends on the listener's familiarity to the particular disorder, and it's a rare condition. So there is limited data and study done for this disorder. And misdiagnosis is very common. It can be misdiagnosis of the psychiatric disorder or the apraxia of speech, which is one of the symptoms of this disorder, can be only diagnosis rather than the diagnosis being labeled as foreign accent syndrome. Ethical issues such as patient identity and psychological distress. Social stigma is also a very prominent ethical issue in this case. Discussion. It's a multifactorial disorder. There is a changes in the structural brain damage, and the functioning brain is also affected. There is a strong overlap with apraxia of speech, but patients have better control of speech rather than which is seen in the apraxia of speech. Social linguistic influences, the accent perception varies by listener. For me, I will hear a different type of accent, and for another observer. So the future prospects, AI-based speech analysis for early diagnostics, objective classification, and advanced therapeutics such as 3D visualization of tongue movement and electromagnetic orthochlorography can be done. And musical training, especially vocal music training, can be given to the patient. And personalized rehabilitation programs can be given to the patient, which needs to be tailored to the patient's needs. And improved neuroimaging techniques can be used. In conclusion, FAS is a rare but clinically significant and a complex disorder with strong link with neurological lesions, specifically stroke, and it requires accurate diagnostics, multidisciplinary management, clinical, linguistic, and psychological evaluation. And therapeutic therapies are offer promising outcomes in this case. More research needs to be done to standardize the treatment protocols and procedures, and better diagnostics tool needs to be developed for this disorder. In future, AI can improve accuracy of the diagnostic and treatment outcomes of the patient. These are my references. Thank you, ma'am. Thank you. Thank you, ma'am. Thank you for the opportunity.